Hi everybody, Dr. Scott Taylor here from Southwest Spine and Rehab in Mesa, Arizona. I want to take just a second of yours and I want to show you this final adjustment video. We call it non-surgical spinal decompression therapy. We have wonderful Chelsea again. Chelsea, if you wouldn't mind coming into the frame here. We're going to have our patient come to this position. She's going to sit right here. And before we get her set up for the decompression, just want to give you a brief overview of what's going to happen and why we do decompression therapy. Predominantly, we use non-surgical decompression for patients with discogenic pain, whether that's in the back or the neck. In the low back, if you've ever experienced or you know anyone that's had pain that kind of comes from the low back and goes down into the legs, a lot of people will call that sciatica or lumbar radiculopathy. We utilize this to help create a negative pressure in the disc. So this table is going to traction or pull Chelsea's lumbar spine apart very slowly over the course of 20 to 30 minutes is how long the treatment usually takes. It's based upon the patient's weight and how much they can tolerate, but it's approximately about that much time for each patient, okay? So we're gonna show how this is to be done. So Chelsea, we're gonna lie you on your back and your head's gonna go on this table, and I'll adjust these little bolsters under your legs. So these will just go under Chelsea's legs for some comfort here. We're going to go like that. And there's two belting systems. This first one goes on top of the hip bone here. And so it's all Velcro and it could be taken off very easily, just like that. It is kind of snug. It's kind of snug on the patient when you get it on, but it has to be tight because it has to hook to the top of your hip bone so you don't slide out of the belts. But the belting system it's like a seat belt with a little ring right here. Now we're going to tighten this quite up a bit more because Chelsea's a pretty small gal, and so we'll do that. And then the next thing that we do is we take this from down here, and then we're going to hook it to this ring here like that. And then I'll come to this point of the table, and then we'll pull that nice and tight like that. And then just the last belt that the patient will experience is one that kind of just goes over the torso like that and holds the upper part of her body still. We'll adjust these legs. Chelsea, you comfortable in that position? Perfect. So this is the position that the patient will be in for the lumbar decompression. We'll set the computer program to the desired treatment cycles and the region that we're going to be treating. The treatment angle is important here because if we bring this feet up higher, it treats higher up in the lumbar spine. If the table is more flat, it treats lower in the lumbar spine. So based upon the specific site of your injury, that'll be adjusted. So a lot of people will have disc problems, but they also have facet issues or facet syndrome. That's where the weight-bearing aspects of the spine and the back of the spine touch each other and they're rubbing on each other. This is also a great treatment for those patients because it distracts the spine and relieves all that pressure. So the same thing, the same concept, we also do for the cervical spine. So this attachment to the table, this big metal post would fit under Chelsea's head and it would be placed like this on the patient. Obviously the patient would be lying down. We never do both lumbar and cervical decompression at once. Sometimes you may need both, but predominantly it'd be the lumbar or the cervical spine. But this treatment is great. If you've ever had numbness or tingling down the arm, or cervical radiculopathy is what it's called, weakness, this is a great therapy. You maybe have struggled with headaches and neck pain for years. This could be the answer possibly for that. Works really, really good. Spinal decompression works best when it's done periodically throughout the week. And again, it's not a one treatment fixes all your problems, but it's very, very effective. And it can, a lot of times we've seen patients avoid epidural injections. We've seen them avoid back surgeries with this as well. So if you have any other questions about non-surgical spinal decompression, please check out our other videos or drop us a line. Have an awesome day.